And some rural areas are also seeing a spike. Williams County dealing with some severe cases. We have the Williams County Health Commissioner Jim Watkins with us this afternoon. So what's the current COVID situation in your area, Jim?
Well, where we're at today is that our medical system is certainly being strained with a number of hospitalizations in our community. We are seeing high spread of the virus in the community. In fact, we are number one per 100,000 in the state of Ohio right now at 1,124 cases per 100,000 as of last week.
As a health commissioner, when you see these numbers, what's your first thought?
Well, I think that as we saw these numbers going up, we certainly started to be very concerned for our medical system here. We stay in constant contact with our physician providers, as well as our hospital and other providers in the community. And we knew from what they were seeing that this was certainly on the uptick. With that, we knew that could result in a very rapid increase in hospitalizations, which it has in our particular case. And knowing too that we are not an island, and we know that we will be affected by the other counties and the spread of the virus in them. Concerns about being able to provide care to residents in our community when they have health needs.
When you talk about the strain on the hospitals, how is it impacting the hospital system in Williams County specifically? Are you at a point where those facilities are at capacity?
They definitely are nearing that. As with everyone in healthcare these days, staffing is an issue, and they've expressed that to us, is that even if they can get additional equipment or have room for individuals, there comes a breaking point where you just do not have the staff to be able to provide the care.
What's causing this spike, in your opinion? Is it a low vaccination rate?
Absolutely. We know that vaccination works. Our own data that we look at here in Williams County, we thankfully did very well with our 65 and older population. And we are seeing a drastic difference between this year and last year with that population being hospitalized, much lower numbers for that group this year. So, vaccination is the key. Certainly wearing masks during this time are important also, because the data tells us and shows us that it is significant in helping to reduce the spread.
I know a lot of people, when you talk about the pandemic, they might say, I'm over it. Do you think that we're going in the wrong direction here, at least out in Williams County?
Well, I think all of us are very tired from that standpoint. So I think, it's difficult and frustrating for us all that we have not made more progress. So I think that has played into this quite a bit, that we're tired. Everyone's tired.
And Jim, finally here, the hospitals are strained. Everybody's tired. You're asking people to do things that, they had to do a year ago when this pandemic was really, at what we thought was its peak. So what's the plan moving forward for the Williams County Health Department?
So tomorrow we have a local COVID defense team made up of manufacturing, elected officials in the community, and as well as our medical community. And we'll be meeting with them tomorrow to make a special appeal that we see what's going on. We need to encourage more people to become vaccinated for themselves and their families, and for the good of the residents here in Williams County.
All right. Well, thanks so much for being with us, Jim. We appreciate the insight this afternoon from Williams County.
Thank you.